Well, prior to today's developments, there were 18 confirmed cases with no new cases for 2 straight days here in Singapore. Let's take a closer look at the patients. Well, first, the virus doesn't discriminate. Men and women have both been infected, and age-wise, it's also affected both younger as well as older people. And after putting together all the information on the first 18 patients, we've come up with this graph. Now, the 7th patient was discharged just today, as indicated there. We've color-coded the case timelines into 4 portions as well. Now, the blue area is when they arrived here in Singapore. The yellow is when they started showing symptoms, as reported by the Health Ministry. And the orange, well, that's when they were notified as suspect cases. And the red area, well, that is the date that they were confirmed as cases. Now, taking a broad look, we can see that days can pass from the time of arrival in Singapore till when those symptoms were shown. These 4 cases, for example, they spent around a week in Singapore before symptoms even emerged. Plus, we don't know when exactly they were infected, meaning that they could have been carrying the virus even before reaching here. Now, experts say that the virus roughly has this 14-day incubation period. Another observation, that it can take a while between when symptoms start to show and when one is notified as a suspected case. So let's look at these 2 cases in particular, and this can last up to a week. It's still unclear just why this is so. The Health Ministry hasn't specified the exact reason, but the ministry has been constantly urging those who show symptoms like having a cough, a fever, a runny nose, to wear a mask and go see a doctor. Now, another unknown, how exactly the coronavirus was transmitted. But there's a clear trend that there was exposure to another infected patient. For instance, the first and the third patients are father and son. There are also 2 pairs of cases where the patients were traveling companions. Now, there is a married couple who were diagnosed, one after the other, and one was a close contact of another patient. Authorities are carrying out contact tracing to identify those who had close contact with the patients. And even with the 6 new cases, they've stressed that there is still no evidence, as of now, of widespread sustained community transmission. Well, starting tomorrow, schools and elder care facilities are going to cut down on mass gatherings. Workplaces have also been urged to implement enhanced measures, and all this to protect against coronavirus infection, as Singapore reported its first locally transmitted cases. In schools, large groups and communal activities like flag raising, assemblies, camps, mass celebrations, they're going to be suspended. Recess times as well, they're going to be staggered, while co-curricular activities and after-school programs will also be held in smaller groups. This also applies to preschools and social services for vulnerable groups like elder care facilities. The Manpower Ministry, meantime, has urged businesses, particularly food and beverage outlets, shops and hotels, to step up the frequency of cleaning. Now, this is especially in areas of high traffic or human contact, like service counters, those meeting rooms, pantries and toilets as well. Clear guidelines should be given to staff to handle customers who appear unwell.
In particular, we are highlighting that companies should consider that if a customer is visibly unwell, to actually advise the customer to seek medical assistance, seek medical treatment, and also offer other options that do not require the person to be physically served.